Welcome back to another episode of Talking Shit. Shit is, of course, an acronym for Straight Health Insurance Talk. My name is Matt Allen, and with me is Aaron Miller.
Salutations.
What are we talking about today, Aaron?
Well, today I want to more cover a situation. And the title of the situation is They Delayed Retirement for No Reason.
Okay.
But the reason is that they didn't think they could afford health insurance. Health insurance was on their mind, and they couldn't break away from their jobs because of this misconception that health insurance was in the way.
Okay.
So I'm going to give you the snapshot, and we can just start to break down the situation and talk about what you would do and what you would recommend.
Okay. So you're just going to hit me with some stats on this hypothetical couple or family.
Yep.
And what I would advise them to do?
Yeah, talk about the pressure points, talk about, what their default probably is, why they're making the decision they're making currently, and how we can help them retire early.
I love it.
So we have a family of four. James, husband, 63. Jenny, wife, 56. Two kids, age 19 and 22, both still in college. Their income is $300K plus, doing well. Part of that's because James is an entrepreneur, self-employed, raking it in, and Jenny is a school teacher, and they get their health insurance through Jenny. So business is booming. James can sell his company at any time and get that big check in the door, but they don't have health insurance if they both retire. And so they're just sitting around waiting because they don't know what to do, but they're ready.
So it feels like financially they're ready, but they can't break away from this idea that Jenny's just going to have to work till she's 65 so we can have health insurance.
Yeah, absolutely.
And she's probably put in decades in that school system. She's ready to bail.
Oh, yeah.
She wants to go enjoy life with James. Okay. But they're worried about health insurance. Okay. What's the general health of this family?
So the kids are healthy. Jenny is on a brand-named autoimmune medication. Yeah, and James has type 2 diabetes.
Oh.
So they got some health problems, and that's why they've been really relying on this health insurance to help them, navigate this. But, other things they like to travel. Mm-hmm. They, want to buy a home in Florida, do a little snowbird thing. Mm-hmm. And, yeah, so they're worried about their own health.
Okay. Kids are out of the house. So this one in my mind is very simple and straightforward, but as I walk through it and break it down, it will probably have some mystifying aspects to it that slow me down and make me explain it.
Yep.
James is 63, so is he like 63 and a half?
Yeah, he's 63 and a half.
Okay. All right. So here is what I would recommend. I would look into selling the company right away. What are we waiting for? James, you built this thing up. Go and get your money. And Jenny, if it were right now, I'd tell her, hey, you're not coming back for next year. This is your last year.
You're telling her to
pull the plug, put in the 2 weeks, say goodbye to the kids. You're not running it back. Make sure you get paid through the summer, but after that, you're done. Family's done. Because what we're going to do is you and James are going to go on COBRA as soon as your coverage ends through the school because you've retired. COBRA will last up to 18 months. So you are going to exhaust that. So it'll probably get Jenny to about age 58, and it'll get James all the way to Medicare. James then graduates to Medicare. Medicare is going to be cheaper, better. It's going to work down in Florida. It's going to work here in Indiana, wherever they go. Medicare is fantastic, and it'll be lower cost than they're used to. And then we pivot Jenny to an ACA plan. The reason I'm saying don't put the whole family on it is the whole family being on it would be extremely expensive through COBRA. We're talking like $2,400, $2,500 a month, which I know James just got a huge payout and he can afford it. But if both the kids are in college, look into their university health plans that are offered. Colleges almost unilaterally will offer a health insurance plan for the students because it is a requirement of almost every university I've ever seen to have the kids have health insurance. And so part of that is they offer a group plan, and that group plan usually has very good deductibles, premiums, networks, because it's a generally healthier, younger population at the university. So it's a much better payout as opposed to getting them a private plan or an ACA plan or anything like that. And it'll be cheaper than COBRA. So put James and Jenny on COBRA for 18 months. Once James hits 65, take him off COBRA, put him on Medicare, get a Plan G, get a Part D. He's home free. Jenny will be 58. And as soon as her COBRA expires, you said she's got a pre-existing condition?
She does.
Okay.
Yep.
So what we're going to do for Jenny is we're going to look up on the ACA. We're going to find her autoimmune name brand medication. We're going to find her, primary care physician. We're going to find the local hospital where she lives. And we're going to make sure all that stuff is in network for the ACA. Now, the huge drawback to the ACA, however, is that these are all narrow network plans. So while we can dial in Jenny's meds, Jenny's doctors, Jenny's hospitals, what we can't dial in is out-of-state coverage and coverage for the unknown. And so what Jenny's also going to need, in addition to the ACA plan, is a supplemental plan that wraps around this narrow network, that in case Jenny wants or needs to receive health care outside of the ACA's plan network, she can do that. So this is now covering her in Florida. This is now covering her coast to coast for the big stuff like heart attack, cancer treatment, surgery, hospital, emergency room, car accident, all that stuff. The ACA has a narrow network. So you're only going to be able to receive care for these types of things in the network. So we can dial in what she knows she needs for health care, but we can't dial in the unknown because we don't know what it is. So that's why the supplement is necessary. We keep the kids on the university plans for as long as they can. I think you said they're 22 and
19.
22 and 19. So the 19-year-old can probably be on it for a few years. 22-year-old will likely graduate. Now, if they get a job with coverage, bam, super easy. Go get a W-2 with a health insurance plan and enroll in it. If they do not, that's the time when we can take that 22-year-old to the ACA, because they will likely have an income that qualifies them for a tax credit. So we're going to be getting a very heavily subsidized ACA plan, or potentially even state-run coverage if they have trouble finding a job. If they make really good money and they're healthy, but they're not offered health insurance, they can get a private plan. Those are super cheap. We're talking $250 a month. No network restrictions for him. 19-year-old, keep the university plan until graduation. And then same thing goes for them. You find a job with health insurance, you take the job with health insurance, you take the insurance on there. If you don't have a plan, then we look at income. Hey, does your income qualify you for a tax credit on the ACA? Great, we'll go there. Maybe it qualifies you for Medicaid for a little bit.
Yeah.
Hop on there. If your income is really good, don't get a tax credit, and your health is still good, and you need health insurance, you're not offered it through your job, we'll look at a private plan. Again, $250 a month for a great wall-to-wall private plan. And that'll get mom all the way to Medicare as her ACA plus supplement. It'll cover in and outside the network. Then we just cancel that when she hits 65, get her on a Medicare supplement just like James. I mean, that's pretty much the whole thing. So slam dunk COBRA, James and Jenny, kids on university plans till they graduate. Jenny, once COBRA expires, ACA plus supplement. James, as soon as he turns 65, supplement, Part D, we're out the door.
Got it. So they're going to have this windfall of cash, right, with him selling his business. So COBRA definitely makes sense because their income will not qualify them for a tax credit. But what if in 2027 they're expecting their income to be pretty low since she's no longer working, he's no longer raking it in? Is there ever a situation where you would move them to the ACA for 2027?
There potentially is. So if this happened this year, we could definitely take a look at it because Jenny is going to need to be on the ACA, and so is James. Is going to need to be on the ACA due to their pre-existing health conditions. They won't qualify for a private health insurance plan. And so if their combined household income in 2027 is below $84,600 in a modified adjusted gross income, we are absolutely going to want to at least look at the marketplace. But the downside there is because they're planning to travel and because they're planning to go to Florida and all that, we're going to need that out-of-network supplement as well. So in certain situations, even with the tax credit and the ACA plus a supplement, that total premium may rival the COBRA premium. And so we would just need to do an apples-to-apples comparison of the benefits and the premiums, because if COBRA's, $150 more a month than this ACA plus subsidy plus supplement amalgamation that we've come up with,
sure,
is it really worth saving the $150? They just had this huge windfall of cash. Why not just stay on the COBRA plan for the rest of that year? Now, moving forward, once James is on Medicare, if they maintain that lower income, well, now we're talking. Now Jenny, we still dial in her ACA plan, but instead of paying full price for that, maybe in 2028 and beyond, since she has 9 more years to go till she's 65,
right?
Now we can utilize an ACA tax credit on there, optimize her ACA plan, add the supplement. Now it's much more affordable to have both of those. That was absolutely something I would want to take advantage of. But unless COBRA is exorbitantly expensive compared with the ACA plus supplement route, I'd probably just exhaust COBRA.
Got it. And you asked a very specific question in the beginning. Is James 63 and a half or is he 63? So if he was just had his birthday, 63, they're retiring right now, taking COBRA, is that when we would want to look at the ACA more in depth right away if COBRA's not going to take him? Again, or is it still a price comparison?
It would still be a price comparison because once COBRA expires, that's a qualifying life event because you're losing major medical coverage. It creates a special enrollment period, and these ACA plans are guaranteed issue. So I don't ever want to turn a blind eye to COBRA if we know we're going to need an ACA plan after COBRA anyway. Well, that plan can't be denied to us. So it's not a situation where we need to worry about pre-existing conditions and being accepted by an insurance. COBRA is always going to be higher quality than ACA, even ACA plus that supplement I'm talking about. So unless COBRA is like $1,000 a month more or $500 a month more than this ACA plus supplement, and we just had this huge windfall of cash, I mean, what are we really doing? Now, if you told me James and Jenny, they're just barely going to be able to retire, and they just want to. They're just sick of working. They just really want to retire, and they don't want to pay, $1,500 a month for COBRA, and they qualify for a tax credit. Of course, I'm going to look at it. If saving $400 a month to them is a huge deal, well, we're going to look at that. Yeah. We're going to factor that in. But I don't want to rock the boat and try to make a sale and switch them over to this other plan if COBRA's there, COBRA's comfortable, we have pre-existing conditions, and it's a similar price to the ACA plus supplement. Why are we rocking the boat?
Yeah. No, that makes sense. And you mentioned, once, Jenny has exhausted 18 months of COBRA, and we're looking at the ACA. Now, do the 2 kids still apply to the household as long as they're on the tax, as far as the tax household goes? Or how does that work, and would that benefit them to look at having the kids on as well?
So it definitely could. You threw me for a loop at the beginning of this, talking about this huge windfall of cash. And when I hear that, it's not like dollar signs are going off in my head, because everything that I've described that I would recommend for them, I don't make any money off.
The COBRA,
like
the school plan,
like the people going on COBRA and the people going on the university plan, I don't sell those. Right. I don't make any money off those, but that still would have been my recommendation because they have the windfall of cash, and because if I can lead people to the best possible coverage and it fits in their budget, I'm going to do that every single time. If we are instead more price sensitive, maybe, you could have a huge windfall of cash and still be price sensitive. You could still be like, hey, just because I got all this money doesn't mean I don't want to optimize and save as much as I possibly can. We can absolutely talk about that. So when Jenny's COBRA expires and the kids are on the university plan, when that COBRA expires, that is a qualifying life event for the whole household. And so it's going to come down to whether or not they're still claiming the kids as tax dependents.
Okay.
So the 22-year-old may have turned 23. Now he's on his own. Now he's making $45,000 a year at some job. He's got his own health insurance. He's not tax dependent anymore.
Right.
So Jenny would then only have the younger kid as a tax dependent. Now you might say, okay, since Jenny's going to be on the ACA, Jenny has a tax dependent at university, and the university requires her, the young daughter, to have health insurance. Let's put Jenny and the daughter on the same ACA plan. We can absolutely do that and save money, save premium, because now our tax credit's going to be larger because we have the 2 people on there instead of just the 1.
Yep.
So we're going to have a good premium on there. Now the issue is, where's the daughter go to school?
Oh.
Okay.
Yeah.
Because this ACA has a narrow network. It's a narrow network plan. And so if, we're here in Indianapolis, let's say Jenny and James, they live in Indianapolis, but they want that home down in Florida. They're going to do the snowbird thing. Okay. Let's say Jenny goes to school at Miami of Ohio. Great school, but an Indiana ACA plan.
Let's go Redhawks.
An Indiana ACA plan isn't going to cover her there. So even if we get this huge subsidized plan because Jenny's modified adjusted gross income of the household is under the threshold and we get this huge tax credit, we've got pre-existing conditions covered, okay, but the fit might just be terrible for the daughter.
Yeah.
Because she's now on an HMO that works really well in Indianapolis, but at Miami of Ohio, which is located in Oxford, it might be terrible. Like no doctors may take it there. And likely they don't, because a lot of these ACA networks are on a state-to-state basis. So then we would need to supplement the hell out of the daughter's plan with a private plan. Now the premium's creeping back up. Why aren't we just doing the university plan for her and doing an ACA plus supplement for Jenny? We can make this as complicated and intricate as we want to. I can try to sell as much health insurance as I can. Like, I'd make money off that.
Sure.
If I got the daughter on an ACA, I make money from the ACA, and as a supplement, I make money on that. It probably just makes more sense for it to be on the university plan. Now, we can do dollars for dollars. We can take a look at it, and this is all stuff that I would walk through this hypothetical family with over a Zoom call and just share my screen and break everything down. But I don't know, even though we could potentially get a larger tax credit on the ACA, it's now an issue of fit. Now, if she goes to University of Indianapolis, all right, maybe now we're talking.
Right.
But if she's outside the state, it doesn't make any sense.
No, I get that. Interesting. So I feel like if I was to be retiring, which I'm 29, I'm not retiring, I feel like I would want to plan that, but like further in the future. But people could retire, like in this situation, they could retire tomorrow.
That's what I'd tell them.
Yeah.
I mean, unless she had some sort of burning desire to go back and teach another year of school. If they truly were coming to me like, hey, is it even possible? I'd say, hell yeah, it's possible. You can do it tomorrow.
Yeah.
And I wouldn't make any money for a year and a half.
Right.
But that's what I would recommend to them is, hey, this is what would happen. This is what would happen. This was what would happen. These are the options that I recommend. This is what I think. Talk to me in a year and a half when I can sell you something, because you are going to need to switch. COBRA is not forever. University plans are not forever. They only work as long as you're a student. COBRA only lasts the 18 months. So they'll need to transition to other things, but I think it's kind of a slam dunk in this hypothetical situation. Mom and dad take COBRA. The kids go on university plans. Once COBRA ends, dad's on Medicare. Mom's on ACA plus supplement. Kids, once their university plan ends, they either go on work insurance, they go to the ACA if their income qualifies them for a tax credit, or they go to a private plan if their income's too high.
No, that makes sense. Now, I think there's probably some questions out there. It's like, okay, Jenny has health issues. But let's say Jenny's got a squeaky clean slate bill of health, right?
Oh, you're trying to work in the word slate as well?
Yeah.
Squeaky clean slate?
That's tough.
Okay.
Comment squeaky clean slate.
Well, that was good.
Yeah. Comment. So what if she's perfectly healthy, right? She's 58. She's 56, perfectly healthy. Now, how does that change her situation? Because putting her on COBRA, is great for that 18 months.
Mm-hmm.
But there's always the chance that, right now she could qualify for a private plan. But in the future, after COBRA's, expired, maybe she couldn't.
Well, that is a very interesting scenario, because that kind of leaves James in the lurch if we are going to move Jenny to a private plan. Because James won't have access to the COBRA plan since Jenny is the primary employee.
Oh, they'd both have to be on it.
In order for James to get it.
Okay.
Jenny could get it by herself.
Okay.
James could go off on his own. James can't get it unless Jenny's going on Medicare, then James could get it. But if Jenny's just like, I'm getting a private plan, I don't want COBRA, can you give it to my husband though? Mm-mm.
Interesting.
That's not how that works. So, in that hypothetical situation, so basically what you're saying is Jenny's healthy right now, but Jenny needs 9 years of coverage to get to Medicare. James needs 1.5 years. We are worried about the quality of Jenny's health insurance for those 9 years. Because if she takes out COBRA, we know the quality is high. They've been on this plan for decades. It's going to cover them well. But for Jenny, it won't get her all the way there. Jenny's still going to have 7 more years where she needs to be covered.
Right.
And we can cover her with the ACA plus an out-of-network supplement. It just can be a little clunky. You're using 2 products. You're combining premiums. Maybe they don't qualify for the tax credit. Maybe they're drawing distributions and they're above the threshold. So now a full-priced ACA plus the supplement, it's pretty expensive once we start adding all that stuff up. So instead of even going down that route, if she's healthy enough to qualify for a private plan, why don't we just get her on a private plan right away? Because the private plan will be cheaper than the ACA. It doesn't have these network restrictions, so now we don't need the supplement. She'll be covered in Florida. She'll be covered in Indiana. She'll be covered in Oxford when she visits her daughter at Miami of Ohio.
Yeah. Bingo.
Go Redbirds.
Go Red Hawks.
Red Hawks. Ah, there you go. But if she takes out COBRA, here's the nightmare scenario. Here's the monster under the bed. Could keep you up at night.
Ooh.
Let's say she goes, yeah, but James needs COBRA. We're going to take COBRA for the 18 months. Then we're going to get James on the Medicare. And then I'm going to get the private plan. Okay. That will likely be possible. That will likely happen. I'm not saying for sure. I'm very intentionally saying likely because there's a non-zero chance that Jenny develops some sort of condition over those 18 months of COBRA. If there's a condition developed, if she becomes type 2 diabetic, she's got out of control, undisciplined cholesterol or high blood pressure, develops that autoimmune disease, now needs the $800 a month medication, whatever happens. If by the end of those 18 months, Jenny now has a pre-existing condition, well, now that private plan likely won't insure her. Whereas if she took it out at 56.5, when she was healthy, the private plan is guaranteed renewable and can never cancel her. So she could always be on that plan, even if she got sick. And so that's a situation where we just have to sit down with the client and just walk through what the options are. Because if that bothers Jenny, if they just don't like, hey, I take out COBRA and then, what if I can't get that private plan? Here's what I recommend. Jenny, you take the private plan right away. You give the school your walk-in papers, and that day we sign you up for the private plan. It's guaranteed renewable. Keep it as long as you want. Then, depending on the economic windfall that they got,
yep,
she could either take out COBRA for her and James until he hits Medicare.
Oh.
So now we're paying a lot of money for health insurance.
Yeah, big ticket.
But we've locked in that private plan for when COBRA expires. Because as soon as James goes on Medicare, you can just cancel the COBRA. Jenny's already covered.
Interesting, yeah.
Or Jenny's on the private plan. We just say, F you to COBRA. We don't want it. And we now transition James to an ACA because he's diabetic, you said.
Yep.
We lock in all his meds, all his doctors, all his everything, and then we give James that out-of-network supplement.
I see.
So now James has full-priced ACA plus out-of-network supplement for when they travel. Once he gets 65, cancel all that, save a ton of money, get on Medicare supplement. Well, hey, Jenny's already got her private plan in place. Jenny can take that all the way to 65. It's just about what is the comfort level of the couple. Do they want to, quote unquote, roll the dice with COBRA till James goes on Medicare and then hope they can qualify for the private plan? Or just start right away with the private plan, pay a ton of money in premiums, but know that you've got good coverage for everybody, for every situation. Kids are on university plan. You're both on COBRA. Jenny's already got her private plan locked in. For some people, that peace of mind might be worth it.
Have you seen that happen before?
Just a couple times.
Yeah.
High net worth individuals who want to make sure they don't want to think about health insurance. They don't want to think about healthcare because they've never had to in decades. Mm-hmm. They've always had this great plan, and they've just said, Matt, obviously we don't want to just write you a blank check, but we want to make sure that our finances are just protected at all costs, no matter what, until forever, because once they get on Medicare, they're protected.
Right.
And so just a handful of times have we done that. It is the safest thing to do, would be COBRA and Jenny on the private plan right away, but by far the most expensive.
Yeah.
So not the right fit for everyone. But it has been done, and if you do have an unlimited checkbook and you want the best protection, that's what you would do.
So I think the point we're making is if you can financially retire, we can make the health insurance work.
Absolutely. Every time.
Every time.
You can put in those 2 weeks and then just make sure you talk to us.
Do it.
Yeah. There's people who spend so much of their time and so much of their life putting away money, being responsible, being prudent, investing, and positioning themselves to live this life in retirement of, comfort and luxury, and they don't have to work anymore. And a lot of these people are so far ahead of schedule, either because their financial planner was great, they got fortunate on some investments, or they're just really disciplined, whatever it is. But delaying enjoying what you've been working your entire life for simply because of health insurance, you don't need to do that. You shouldn't do that. You straight up just should not do that.
Yeah.
If you're ready financially to retire, stop working.
Stop working.
Stop working. Enjoy it. Go visit the grandkids.
Yeah.
Go hiking in Machu Picchu.
It's hard to get there.
Go surfing. Go down to Florida. Buy the house. Do the thing. Don't keep working just for health insurance.
We can bridge that gap for just about anybody.
Not just about. For everybody.
Who have the finances.
Well, yeah. And, honestly, if you're not making that much money, I could do it for you too.
Yeah, no kidding.
I really can. The Affordable Care Act is there for a reason. Give me a situation, I'll give you a solution. Give me 2 hours of your time, and I'll give you back years of your life.
Sounds pretty good.
Yeah. They've worked for it. They've earned it. Let's make it happen.
Lovely. That's all I got on my end.
You feel good about that one?
I feel good.
Yeah, I do too.
Strategic timing.
James and Jenny, reach out. You can contact me or Aaron. Go to the website. Fill out a form.
Get going.
Yeah, let's talk. This has been another episode of Talking Shit. SHIT is, of course, an acronym for Straight Health Insurance Talk. My name is Matt Allen.
And I am Aaron Miller.
See you next time.